said that there were 109 samples tested, but it says here 120. Which one's the right figure?
120 is now as those figures are upgraded by the hour. One thing we want to make you extremely aware is that when we are dealing with a new virus, there is unpredictability and things change over time and literally can change within minutes. So as of that is the new information that you have. Other questions?
Can you talk a little bit more about the potential for school closings? What is going to trigger that? Who will give those orders? And how many communities are we looking at right now that might be facing that?
How many communities? That's a good question. We were recommended by the CDC to close the school based on one case in the school, and only that school was closed. So in the community where there's multiple schools, only the school where this case was, and the local health district continued to evaluate any of the students who were in that class with that potential exposure. The guidance that came out just today indicates that schools are now to close for 14 days, not for 7. So the initial recommendation was that the school closed for 7 days, and the 7 days ended today. So the students were going to go back to school on Monday, but the new recommendation says 14 days, and that's based on some indication with this virus that it potentially spreads for up to 14 days. So again, this is the changing environment that we're having to deal with. Now, how do we notify communities? When a case is called in, a suspect case is called into a local health jurisdiction, they evaluate the exposures, and it's very similar to what you might experience with foodborne illness. Where have you been? What did you eat? They ask the person, did this person attend school while they were ill? Yes. Okay. Now we need to look at the other students in the school and evaluate closure of the school.
Can you define what quarantine and isolation is? Because we have actually had some people contact us saying that they are not being isolated, but they have been given medication. We had the OSU patient who was released allowed to go home. What is the status of whether they're quarantined or not?
That's a really good question. Thank you. A person is isolated if they're ill, and you might encounter isolation most often in hospitals where a person is put on isolation for tuberculosis, respiratory isolation, for influenza. They have symptoms, they can spread the disease. Quarantine is for those who have been exposed, like family members, like other school students who are not showing any symptoms, but we have every reason to think that they could come down with symptoms because they've been in close proximity. So a quarantine is issued because we think that there's the potential for the contacts. The contacts. They have to have had potential droplet exposure to the case.
So the probable cases, are those people staying home now?
The probable are sick. The probable are to stay home for 7 days.
Okay.
Yes.
But they don't necessarily have to stay in the hospital. They can be...
No, in fact, they haven't been in the hospital in Ohio. They might have been evaluated in the emergency department, but have not been hospitalized because we have seen mild illness in Ohio.
With that in mind, since it is mild, how do you convince people that this is something that they should take seriously?
Okay.
This is one of the reasons why we have chosen to have this particular news conference, and this is why we're also going to have frequent updates so that we can make sure that the public understand what it is we're dealing with. And as I said earlier, it's very unpredictable. It could change over time. I do not want us to assume that the mild conditions that we're currently having cannot turn serious. We do not see an indication at this time, but we only know what is happening in Mexico, and we also know that we've had one death in the United States. So our goal is to keep the public prepared and informed so that they can make appropriate decisions. And this currently is mild, but it may not always remain mild. And that's why the public health message of reducing the spread through hand washing and protecting the cough is so extremely important.
Beyond that, can you talk about things that individuals might do considering what's going on, should they be thinking about preparedness such as preparing for themselves to potentially be quarantined? Should people be making sure they have water and food, and are we there yet?
Well, I think it's always important to prepare for the future. And it is important to, what we don't want to do is frighten the public. We want to know that this is serious, but it is not anything that they should be afraid of if we arm them with the correct information. So looking forward, preparation is always a good thing. And again, the emphasis on the public health message. If you're in a community and you know that there's confirmed cases or probable cases, things like maybe not shaking hands but doing the arm shake like that could be a consideration. If you need to travel, if you're at a job and you can do a video conference, that would be something good. But again, those decisions will need to be made at the local level because different communities around the state, based on what's happening in that community, may be in a different position. So the variability of this is what you need to understand. That is why it is important for us to provide updates for the public so that they will know where we are.